On this podcast, you'll find interviews with high-performing, successful individuals in life sciences. On a weekly basis, we cover their proven methods, principles, strategies, and mindsets to implement new technologies that scale to meet the needs of people in our world.
Welcome to Life Science Success Podcast. My name is Don, and for those of you who don't know me, I'm a consultant in life sciences, and I help companies manage complexity and increase performance. I also just recently founded the D3 or D Cubed marketing agency, and we're focused in on digital media marketing, primarily in organizations in our space. And so coming up actually tomorrow night, there is a David Bowie event that I'm helping to sponsor with Music Beats Cancer. So if anybody's available around 7 p.m. tomorrow night and you like David Bowie music, please join us. The way to join us easily is to go to my LinkedIn page and look at the posts that I put up recently around that event. So in this episode of Life Science Success, my guest is JoJo Platt. JoJo is a neurotech strategist with extensive experience in the medtech industry, including neurotech research and biomedical devices. Welcome, JoJo.
Thanks for having me. I really appreciate it.
Yeah, it's great. I mean, we got to meet at Bio in the Bayou, and I definitely appreciated, getting to meet you. And just really appreciate you being here.
Thanks. It's always any event that James puts on is one that I'm guaranteed to attend. And for this exact reason, it yields great results.
Yeah, I mean, he's so those of you who don't know James Zanowitz, he's done an interview on here. He's also, a great person who helps to host lots of events at Tulane, one of which is Bio in the Bayou. And so that's what we're referring to here. So, JoJo, would you just take a moment to tell the listeners a little bit about yourself?
Sure. I think my first disclaimer is that I'm not a scientist, nor am I an engineer. I get to play one in my day job, which is also my hobby, which is kind of cool. I work with academic researchers, research institutions, universities, all the way through startups and mature commercial applications for neurotechnologies. So that's central nervous system, peripheral nervous system, any way where you can intervene with energy and elicit a therapeutic effect. That's sort of my realm. So outside of probably your usual guest, I'm definitely a failed biologist, if you ask any of my science teachers.
Yeah, but I mean, there's a lot of us. It's interesting how a lot of us wind up in this space, and my sort of twisty route here, kind of starts with my mom getting cancer whenever I was young. I definitely wanted to be in healthcare then. And then, I just love being an enemy of cancer. So, I mean, anything that has to do with it, I, kind of gravitate towards. And so, I've done a lot in the healthcare space. And then, now just like one of the greatest jobs ever, getting to interact with all these companies that are a little younger.
Yeah, I hear so many people talk about, if your dream job doesn't exist, go and create it. And I like that. I think that's what has ended up happening to me, except without the deliberate component of that. Mine was sort of a kind of falling backwards into where I'm exactly supposed to be. So it's fortuitous, I guess.
Yeah, but I've talked about that as well on the podcast because, I've been criticized before by, we all sort of earn our critics. And I love it whenever somebody criticizes, because then you could kind of reflect on what they're saying. And I get whenever my content's not for certain people, and that's fine. But at the same time, sometimes people say something and it's like, hey, this sparked something, as well. And so for me, it was like, life science success, you must really be a god. I've said this a few times on here, because this individual's quote was just like, okay, so if you really listen to the podcast though, most people sort of follow this really twisty route to kind of wind up wherever they are. And, yes, they had a passion, and yes, they wanted to kind of go after certain things, but this idea of like setting a direct trajectory and getting there, I don't think many of us do that.
Yeah, it did make raising my kids a little challenging. A lot of people that I work with have very, like you said, very deliberate career paths. They start in their undergrad and they know they map out their PhD program and where they're going to go. And their biggest decision is, do I stay in academia or do I go the commercial route? And that's sort of their defining moment um, until they jump fence one or more times. But in raising my kids, it's I focus more on positioning yourself, being open to opportunity, and not closing doors until it's absolutely necessary to close it. So hopefully that helped him out. It's
Yeah.
my friend calls it Lambert's law. Say yes every time until there's a need to say no.
Hmm. I like that. I like that a lot. Well, that leads me to my first real question for you, which is, why did you start your own consulting business?
I started consulting actually out of necessity. I was running a nonprofit that before I got there had fallen afoul of the IRS and the Department of Justice. So the founder was, I like to say, he got caponed.
Oh.
He deserved to go to prison, but they couldn't quite get him on what they needed to get him. His real, true financial crimes. So they found every other way in the world to get him, and I'm glad to say I was part of putting him in prison. But that's another story for another cocktail and another podcast.
Oh, you're sharing that with me at the next bio in the bayou for sure.
Absolutely. So I was working with this nonprofit, untangling it from its historical woes, which really weren't all that bad. Just administrative upkeep needed to be implemented. But it was primarily funded by physicians and dentists. And one of our board members, his daughter, went in for an elective surgery. Everything was fine, came out of the surgery fine, was kept overnight for observation. And the next morning, when the board member went to go visit her, she said, "Daddy, help me, I'm dying."
Hmm.
And was dead by pretty much the end of the day. And it was sepsis, which even now doesn't even really have a clinical definition. It's what's the old Supreme Court analogy about, I don't know what porn is, but I know it when I see it. Sepsis sort of suffers the same vagaries. So it's difficult to define biologically, but you know when you see it exactly what it is. Anyhow, long story, not at all short. We went and wanted to support some sepsis research. And through that, found Dr. Kevin Tracy at the Feinstein Institute for Medical Research. And he asked me to start doing some projects with the Feinstein based around his work, not only in sepsis, but then also his work in the cholinergic anti-inflammatory pathway and how can we manipulate the vagus nerve to upregulate or downregulate the immune response. So because I was sort of serving two masters at that point, both the foundation and then consulting with the Feinstein Institute, it seemed the diligent and honorable thing to do to withdraw myself as an employee and start a consulting company. And then just kept consulting with the Feinstein from there and grew into neurotechnology in a very, very backwards way. Helped them launch their Center for Bioelectronic Medicine. And we started a peer-reviewed journal under the same name. We created an entire center, staffed out 9 full labs, I think, in about a year. And it's still going strong.
Amazing. See, I mean, it all sort of fell into place.
And being open to opportunity and listening, I think, has served me well so far.
Yeah. So, I mean, whenever I look at your history, I mean, so I'm a fairly new consultant. I've only done this for a couple of years now. And so, oftentimes, I have frameworks and other things that I've used from businesses that I've sort of interacted with in the past, or even from my long career history. And so there's plenty of things that I can draw from. But at the same time, I don't have a big consulting history to fall back on. So I wanted to just ask you, in your 15 years in consulting, are there any sort of guiding tips or advice that you might offer new consultants?
The biggest piece of advice that I think we all try to avoid, but at some level, I think we all commit the carnal sin of putting all your eggs in one basket. So for a long time, I did have just one primary client, and that was the majority of my business book. And so when they went through their right sizing exercises, consultants are usually the first to go.
Mm-hmm.
So that was a tough lesson to learn. Eked it out, made it through, expanded my consulting portfolio. But that definitely is the biggest piece of advice. And I would think the other thing is just know your value. Especially as we're moving into a shrinking economy and companies are downsizing, right sizing, belt tightening, whatever it is you want to call it. These are going to be tough times, but it's also a time for opportunities. If you can go in and show how you can positively impact a company's balance sheet and still get the work done, you may have a leg up on an otherwise full-time employee, perhaps.
Yeah, I mean, I agree. I mean, it's one of the reasons why a lot of companies keep consultants is because they're variable cost. It's an easy out for them whenever they need to cut back. And, at the same time, hopefully you're providing a lot of value, and they really find it to be a bit of a jagged pill if they do need to cut back. So as well.
Yeah. Yeah. And demonstrating your worth is not only personally rewarding, but it's also a way to help make the argument for your continued contracts.
Yeah. Yeah. One of the things that I used to always sort of look at is like, are there additional things or runway that this individual has that, could provide even more value for the organization that I'm in, and oftentimes, at least whenever I was in corporate America, that would force me to sort of hang on to people. And then one of the things that I personally do for my clients is try and do this thing called value stacking. So I try and make sure that, not only do they get like the job that I was quote unquote hired to do, but also I'm trying to not just sell additional services, but just provide a lot of value so that, if that moment comes where they got to make a strong decision, hopefully I'm a harder consultant to cut back on as well.
Yes. Yes.
So, yeah, well, it sounds like good tips, overall for somebody that's new in this space. What do you find that's the most challenging part of being a neurotech strategy consultant?
This is maybe not as much of a universal challenge. For me, it is describing exactly what it is that I do. Because like you said, the increasing the value proposition, when I get involved in an organization, it's generally for one specific purpose. And as I deepen that engagement and get more involved in their operational activities, I'm able to see other places where I can add value. And so it's difficult to put a gate or a fence around exactly what it is that I do, because I'm willing to do pretty much anything outside of neuroscience, engineering, accounting, and housekeeping. And probably HR. I don't want to do HR. I'm not good. I am the reason they have HR departments. So I think for me, helping people to find clarity and comfort in putting a name on what I do is a little bit hard. So I basically stick with strategic advisor, business development, operations, and they seem a little more comfortable with that.
Yeah, so if you run across those the HR, finance, those sort of things, that plays a little bit more into my space as well. And I've only had to do this sort of, broadening of scope because, I started fairly narrow. I mean, I went, whenever I became a consultant, I went to an organization that more or less, talks to you about what do you want to do and like, how do you build your consultancy and things like that. And one of the things they said was pick a very narrow niche so that way other people, more or less can't, be in that space. Well, then you wind up with like, you might get one client.
Right. Over specializing is also a dangerous trap.
Yes.
The opposite of mine, but dangerous nonetheless. Very true.
Yeah. So then I luckily I had clients that would say, well, but can you do this? And it's like, yeah, I used to do that, in corporate America for sure. I could do that for you. There's a lot more I can do. So yeah, it's amazing. It's amazing how you could take somebody though and put them in a box, but then at the same time, sort of somebody like you would be advantageous in an organization as well, I'm sure.
Yeah. I was at a dinner last week and somebody asked me, have I ever had to deal with imposter syndrome? And which I've had little inklings of what that might feel like. And I never fully succumbed to it, I think, because the way I look at it is, sure, I haven't done this particular thing yet. So that's not an imposter. That's just, I haven't had the chance or the challenge to do it. And so I try and go out if I'm comfortable taking it on and saying, yeah, let me try. Then, I go out and learn everything I can about the task at hand. And I'm never going to become a sole practitioner, subject matter expert on this one thing. But learning and applying is part of the really fun part of the job.
Completely agree. Yeah. I mean, I completely agree with you. So one of the things that I saw in your bio was that you also are with Joy Ventures. What do you do with them?
So Joy is a great operation. It's a venture fund based in Israel. Their first fund was very successful, focused primarily on wellness applications. So having a positive impact on health and well-being, but it's also a very hard space for investments because metrics are a little bit softer on wellness than they are on something like biotech, health tech, medtech. So this second fund, which is launching any day now, is dedicated to neurotech specific opportunities where there is some really hard science behind each of the investments. We have a chief scientific officer on board, so they've really committed to that scientific rigor. And what I do for them is, since they are based in Israel, I identify opportunities within the U.S. markets for potential investment in their three primary areas.
That's great. I mean, and how long have you been working with them?
Joy and I found each other sort of the latter part of last year. And so they knew everything was lining up for launching the second fund. And that's where we've sort of hit our stride. So it was great. We got to take some of the team and the partners around on sort of a technology roadshow tour, and got to see a lot of exciting projects in a very short amount of time. I think we did 4 cities in 4 days, and just starting that education process and opening the doors to potential really exciting projects, and letting them get a taste for what's out there and get them excited.
Yeah, I'm currently working with a company that is focused on developing a diagnostic around women's health and cancer. So it's a diagnostic that will help to test for ovarian and uterine cancer. It also will help to test for things like endometriosis or fibroids, and so that's sort of the outset for this diagnostic. And whenever you were talking about sort of reviewing all of these pitches, we recently had something that we submitted for as well, and we're asking for additional funding, and they had said that there was an overwhelming response, and out of that they had to choose, like, I think between 5 and 10, companies that they were going to give a fragment of this funding to. And we didn't make the cut, but at the same time, they were just like, I mean, there were so many submissions, we almost couldn't even review them all.
Yeah, and that's hard. I'm used to being on the other side of the fence where I'm helping companies prepare for their funding roadshows and going through their business plan and their deck and their pitch and coaching them through, some of the regulatory and clinical hurdles in their way and where are they going to find reimbursement, and really drilling them and getting them prepared for that. So being on this side of the fence, especially I did JP Morgan a week or so ago, and being on the checkbook side of the table was a very different experience, and it was very enlightening. It's really hard to say no to some projects because you can see that they're exceptional. You can see their promise. You can see where they have an opportunity to succeed. But if it doesn't fit exactly within our thesis or our parameters, then we have no choice to say no, because money is finite for most. Um, but that's, hopefully for me, that's an opportunity to at least make an introduction to another fund that is more aligned with their cause and their indication or technology, whatever it is we're looking at.
Yeah, great. And then you have a podcast of your own. Can you tell listeners just a little bit about what that podcast is?
Sure. Thank you. My podcast partner is Arun Sridhar. He's a brilliant guy. He was the head of discovery at Galvani Bioelectronics. And that's a GSK that was GSK's entrance into the neurotechnology space. And what we decided we wanted to do was, scientific papers are accessible pretty much anywhere. Yeah, you have to pay for some of them, but for the most part, you can get access to the scholarly articles that will help you stay informed on all of the latest research. What we found was really missing was the stories about the people behind the science. And so that is our focus. It's called Scraps with a K. And that's because, the reason is twofold. One is it's spark or sparks spelled backwards. And the other idea is that so much of scientific discovery happens in the hallway, at the water cooler, at the happy hour, at the bar. And, ideas just get written on a little scrap of paper. And that little scrap of paper, if you do well and you save that scrap, it usually ends up getting framed in the corporate headquarters as the defining moment. So that's, we like to get to know people, and it's not unusual for people to cry. I'm not going to lie.
Huh. Well, why do you make people cry on your podcast? That doesn't sound like a good podcast.
It was, I think we've all cried at different points. The most impactful for me was, we interviewed a gentleman named Sandy Greenberg, who in his academic career was actually roommates with Art Garfunkel.
Oh, wow.
And Sandy started to lose his sight during his degree program. And he was pre-law, I believe. And there's a lot of reading and a lot of research that goes on in that degree program. And so without eyesight, he really struggled, and he was going to quit the program between his then girlfriend, now wife of many, 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 many years, and Art Garfunkel were two of the people who were instrumental in getting him equipped and advancing, technology that even he developed, so that he could continue his degree program and finish things out. So the story that he told about Art Garfunkel sort of abandoning him in Manhattan and forcing Sandy to find his way home on his own as a blind person. It sounds horrible, but the ending is really so amazing because Art was actually standing right behind him the entire way. And it was this exercise in demonstrating to Sandy that he could do this, that he was capable, that he had the fortitude and the ability to do it. I mean, art was always right there, but it still brings tears to my eyes. But the technology piece to that is actually something that probably people will use on this very episode of this podcast, on yours, on mine, on every other one. But Sandy built the compression technology that allows you to speed up or slow down playback on an audio file without it sounding like Mickey Mouse or Darth Vader. So when you listen to a podcast at 1.5 times the speed, that's his algorithm that's speeding that up without it distorting, making me sound like a 6-year-old instead of a 12-year-old.
That is amazing. Because I quite frequently get criticized by people that are my generation for quite often listening to things at 1.5 speed. So yes, I'm a frequent user of the compression algorithm by Sandy. So yes, for sure.
Well, we have him to thank, and he has a beautiful book called "Hello, Darkness, My Old Friend," which is, you might know, is the lead into a Simon and Garfunkel song, and it's because of Art and Sandy that song was written.
Amazing, yeah.
Yeah.
So, how often do you put out how many episodes have you done, and how often do you put out episodes and things like that?
We started in July of 2020, and we've tried to keep a pretty regular cadence. Arun and I both have day jobs, so there's that. We have forgiven ourselves if we don't keep up an actual every Tuesday at noon, because we'd rather have quality than a schedule. So I'd say we have about 4 full seasons. We did a side project or a mini series called Psychedelics, which was 10 episodes looking at psychedelics in research, sort of where it all began in early man and then where we are today and everything in between. So everything from the molecular and biological impact of psychedelics all the way through some of the stories with the CIA and MK Ultra, through obviously San Francisco in the 60s, and then some of the really compelling and exciting research being done today.
Amazing. Yeah, I mean, there's obviously great things being done right now with psychedelics that I know of as well. So can't wait to see a lot of people just get more relief than where they're currently bound, right? Because I feel like there's limitations for people with PTSD and other things that we've heard, psychedelics will be able to help with. So definitely am looking forward to seeing that advance.
Thanks. Yeah, it's some of the hurdles I think are as much mechanical in nature in some ways. I mean, we're looking at a shortage of psychiatrists and psychotherapists who are able to help with mental wellness issues, and we're going to have an increase in the number of people who need their services. So we need to bring in, whether it's a device like a brain computer interface to treat major depressive disorder, or a psychedelic component that accelerates therapy and accelerates an understanding and acceptance of traumatic history or depression. Those to me are exciting opportunities.
Fantastic. So there are 3 questions that I like to ask every guest. What inspires you?
The people I work with, honestly, they're the ones who are doing some amazing work. I mean, the brain computer interface is just even taking that segment alone and looking at what can be done already. Seeing patients who are paralyzed actually be able to move their arms and hands and fingers with single digit dexterity. You can look it up online. There's a gentleman named Ian Burkhart, who was one of the early BCI pioneers, who, because of his role in research, he got a brain computer interface implanted and worked tirelessly for years and years and years with the research teams. And as a result, he's able to play Guitar Hero. And I mean, I'm a fully able-bodied person and I can't play Guitar Hero. He would beat the pants off me, and he's paralyzed and he's doing this single digit. Yeah. And so that to me inspires me. The people that are making improvements to people's lives, whether it's restoring speech in ALS or paralysis or post-stroke, or reanimating paralyzed limbs, helping people walk again after spinal cord injury. It's phenomenal.
Absolutely. Thank you for sharing that. What concerns you?
Today, I think one of the things that really kind of concerns me is this is a field with a lot of potential, both promising and there are some potentials for misuse. And so we're looking at an environment that will likely be more closely regulated, which is fine. There should be regulation. I'm most concerned that the regulations will be made by legislators, as opposed to people who live and breathe the field. And I'm not blaming the regulators. They need to make decisions on all manner of things, from roads and freeways to water resources, and they can't be experts at everything. But I just hope that they listen and thoroughly engage our community when they're developing regulations.
So important overall. Last question. What excites you?
Gosh. I have a secret project. Can't talk about yet, but hopefully, we'll let the cat out of the bag on that one fairly soon. I'm really excited to be working with Joy Ventures and to be able to help fund some, do my little tiny part. I'm not writing checks, but to do a little part in helping some of these really promising projects get realized and sent out to patients all around the world. I think that's exciting to me.
Absolutely. All right, JoJo. So where can people find out more about you if they want to try and track you down?
If you want a fire hose of updates on neurotechnology, I'm on LinkedIn, JoJo Platt.
With 2 T's, by the way. So
2 T's. P as in Peter, L-A, 2 T's like tango. That's how I order my pizza. LinkedIn is probably the best way. From there, you can see everything from the podcast, links to all of the workshops that I do, to Joy, to pretty much everything. My Twitter is really just a mirror of my LinkedIn. Sorry. I don't get all that creative. So one place or the other, you're bound to get everything.
Fantastic. Well, JoJo.
And Scraps Podcast.
I'm sorry? And Scraps
Podcast.
Yes.
.com.
Very good. Well, JoJo Platt, thank you very much for being a guest on the Life Science Success Podcast. I greatly appreciate you being here and sharing everything with me about all the stuff that you're doing around neurotech. Thank you.
My pleasure. Thank you.
Thank you for listening to Life Science Success. For complete details about this podcast, including show notes, how to get in touch with guests, and more episodes, please visit www.lifesciencesuccess.com. If there's someone you'd like for us to invite to the show as a guest, please let me know by sending me a message at the podcast website. Please click subscribe on your favorite podcast app, share the podcast, or tell a friend about it. And last but not least, rate the podcast. Thank you again.